I'm talking here to Hadar Marom. What is your role here at the hospital?
I am the manager of Ramat HaChayal Hospital, Assuta Ramat HaChayal Hospital. Yeah.
Could you describe it quickly about the beds, about the people, patients?
So Assuta is a network of private hospital that's located all over the country, and Ramat HaChayal is what we call the flag hospital, the flagship hospital, and is located in Tel Aviv. We have something like 200 beds, and we have 21 operations room. We have an excellent center for oncology, for cardiac surgery, for imaging department, and we have also a gynecologic and infertility center, one of the largest in Israel.
Yeah. And you have about 4,500 people, and what struck us, you have about half of them are the physicians. They are not working full time, but people all over the world come here, of all over Israel come here, and you do like 100,000 operations here?
100,000 operations per year, with something like, I think, more than 10% of all the operations in Israel.
Yeah, and half of the physicians are also surgeons. I mean, it's like it's a dream for a surgeon to come to this hospital because everything happens, right?
Yeah, we have all the technologies in the OR and the other fields of the medicine here in Assuta.
And also this hospital and this whole chain of hospitals is owned by the second HMO here, Maccabi, and I want to talk about that separately. But also the core of this hospital is that the physician and the patient are really deeply connected to each other. It's not hospital-patient, but doctor-patient connection. How does that work?
This is true. Most of the physicians that works here, they bring the patients with them. Some of the services are patients that are coming to Assuta, and we choose the physicians for them. But the private issue is that the patients, he choose the physician that he wants him to make the surgery. He meets him in his clinic, and rather not just in Assuta, in private clinics outside Assuta, and the physicians come here with the patients, and they have their connection. They work here together. He operates him, he follows up him, and yeah.
Yeah, so that's for the private part. You still do 60% of the transactions you do are for the national system, for the public system, and 40% are private system. How is that determined? When are things public and when are things private?
Okay, all the services that we give also for the public services, for the HMOs. So it's although it's a private hospital, the only difference that differentiates it from public hospital is that we don't have an emergency department. So patients who wants to receive a treatment, who come here, needs to come with an appointment that they do before that. Yeah. And of course the insurance company that sent them here or finance this treatment or service are sometimes the HMOs, which is public service, and sometimes are private companies.
Yeah. But Maccabi, who is the second biggest HMO, do they also provide insurance for private healthcare?
Well, all the HMOs in Israel have something that we call extra services, insurance services. Yeah. So it's another level of insurance that is over the what we call the obligated insurance, the basket that we have in Israel,
which you don't have to pay for as a citizen, or do you indirectly pay through taxation, but you don't have to pay separately every year for the public part?
For the public part, you don't pay; it's just taxes, and sometimes you pay the minority, but it's for free, and it's for all the people in Israel. Yeah. But the other level, that is the extra, that it's given by the HMOs, it's also called the private section of insurance, and we also work with them.
Yeah, so Maccabi also basically has that service.
We call it Shaban.
Shaban. What is unique about Maccabi if you compare it to the biggest one, Clalit?
Well, we are only 4 HMOs in Israel, and Clalit is the largest one. Maccabi is the second largest one. I think that there are a lot of similarity between those HMOs, every patient can choose another HMOs, and he can pass through one another 6 times a year. And we see that there are not a lot of movements between those HMOs. Yes.
1.5%.
1.5%. It's very, very minority. Most of the movements are maybe because of the competition between those HMOs are maybe about services, accessibility for services.
So if you move to another location, your hospital is closer, or
sometimes, sometimes this is the main issue why people move from one another HMO.
You're the flagship hospital here. This is, I mean, it's beautiful, fantastic. Do you do more in innovation as a percentage of your budgets here in this hospital than any other hospital?
From other hospital of Assuta?
Yeah. So no, but I mean in general, because this is a flagship, you pride yourself to do a lot of innovation. Does that mean also you have a higher percentage of R&D in your budget?
Well, we have a high percent. I don't know to compare it to other hospitals. I know that we have a special unit that deals with all the innovation technologies. I can tell that in Assuta Ramat HaChayal we are very like pioneer in every new technologies, and in the operations room, in the imaging department, for example, in the field of oncology, we have an MRI Linac, which is the first one in Israel. So also the first robotic system is. Yeah,
you have everything, and this is a dream for a surgeon. Now let's talk about, we come here for virtual care, to basically to monitor the patients outside the apartment, outside the hospital. How is that developed over here?
So we have a new unit, which is a home care unit. And this home care unit, they use a lot of applications and data that receive from the house of the patients to a center here in the hospital that can see all terms of measurements and data from the patients every day, and also telemedicine and application like that.
Yeah. Is that a big part? Is that a teeny small unit and growing rapidly, or is it already like 30% of the patients are using it? Where is it in the development?
We just started this unit a year ago, and we see that it's developing in a very good way because patients like to be taken care at home. Yeah, this is amazing.
Did Corona help?
It's going up. Yeah. They like to take care. I think the Corona did also, a very new change in the way patients focus on the healthcare. They understand that they don't want to go to a hospital. Yes. And now there is a lot of technologies that can support the home care, which developed very rapidly during the Corona, and it was a great opportunity for all of us to look at this.
So for the patient too, but also did the doctor change their mindset? They always want to have the patient in front, but now they accept that they have to also do home care?
Yeah, I see more opening to this kind of care, not just from the patients, also from the physicians. Yeah.
I can imagine. Okay, what keeps you up at night? What is your biggest problems here in the hospital?
Human sources. Yeah? We have a shortage of human sources. Yeah, definitely. Yeah.
And you have a very flexible way because people come here from all over the place, but still, what are the problems? You have enough physicians. You have a huge percentage of physicians compared to the total amount of people who work here. What kind of human resource problems do you have specially? Is it nurses or?
No, I think it's more like the administrative part of the hospital, which are the more low-tech workers that I see the change all over the world about this, and we feel it also here. Yeah.
Okay. Good luck with those worries. Thank you very much.
Thank you.